Deshaun Watson of the Cleveland Browns unfortunately suffers what appears to be a significant right ankle injury today. Welcome back, everyone. My name is Dr. Stephen Wilson, and here on this channel we analyze the mechanisms of sports injuries. So if this is the type of content that interests you, then please consider liking and subscribing to this channel. In Sunday's game between the Browns and the Bengals, the Browns have the ball. Deshaun Watson, number 4, the quarterback. He's going to receive the snap here. So what we want to see when Watson is moving backwards in the pocket, we need to pay attention to his right leg. So his toe is on the ground. He's going to extend back, and his heel is then going to come down to the ground as well. But in this position, we want to pay attention to the positioning of his foot and his ankle. We can see how his foot, his toes are pointed up in what we call a dorsiflexed position. And what that is going to do, it's going to place a significant load that's going to be transferred onto the back of his calf. That's going to be his calf muscle complex here, his gastrocnemius and his soleus muscle. They come down, and they're going to form his Achilles tendon, which is then going to attach into the back of his calcaneus, or his heel there. So when Watson is moving back in the pocket, again, we're watching his right foot, and there you can see his right foot is completely planted on the ground, but his right toes are slightly pointed outwards in what we call external rotation. So that's going to cause the inside of his foot to rock or to tip inwards in what we call the pronated position. So when we combine the external rotation of his foot with the pronation of his foot with the dorsiflex position of his ankle, we can see what the outcome is. When he plants, we can watch the back of his calf muscle here. His brown socks, you can see the reverberation. Right there is the tearing of his Achilles tendon. You can see that into the back of his calf. That is a significant injury. Deshaun Watson will miss the remainder of the season as a result of this. It's that eccentric, or what we can call a negative loading of his calf muscle here. When he plantar flexes, his foot comes all the way down, but Watson is trying to propel himself forward in this position. So with his foot, with his toes up, in a dorsiflex position, trying to go to a plantar flex position with his toes downwards and propel himself forward, that places his gastrocnemius and his calf muscle complex here in a very weakened position. And ultimately, something has to give, and unfortunately, it's the tearing of his Achilles here. We can see the vibration, the reverberation of the muscle as the tearing occurs through the back of Watson's right calf. We're going to correlate that here with the anatomy screen so we can fully appreciate exactly the anatomy that's involved with such a play. So here we see the anatomy screen. We're taking a look from the outside of the right leg. This is a lateral view. So of course we see the lower leg muscles here, the calf muscles. This is the anterior or the front side, and this is the back side or the posterior view. Of course we have your ankle, and then we have your foot here as well. So we want to take a look at the muscles of the complex of the back of the calf. So here we see numerous muscles. We can list them all: your soleus, your plantaris, your gastrocnemius. They all come down and they form this structure right here. This is your Achilles tendon, which then attaches into the back of the posterior part of the calcaneus. Now remember, when Deshaun Watson had the ball in the pocket and he was moving backwards and then attempting to propel himself forwards, his ankle was in what we call a dorsiflex position. So his toes were coming upwards, and what that does, that places an increased load or tensioning of the calf muscles and the Achilles tendon, and then trying to forcefully plantar flex with his toes going down to propel himself going forward. And unfortunately, ultimately, in that case, it was his Achilles here that ended up tearing, and we saw that reverberation, that vibration through the back of his calf muscles. That was quite evident on the replay. This is a significant injury that will require significant medical attention. Thank you for watching today. Take care.